Good day everyone, I am Mary Florian Diaz-Asan, BSN1, a 17 student of Southwestern University, FINMA. So for today, I am going to perform a return demonstration on how to properly assess the cardiovascular system of a patient. So first things first, you need to do hand hygiene to avoid cross-contamination and spread of microorganisms. Also, to make sure that privacy is provided to the patient. First is I need to introduce myself to the patient and get the patient's identity. So good day, sir. I am your nurse for today, Nurse Florian. May I know your name and date of birth, please? Okay, Charlton Cuesta, September 5, 2000. Okay, so how would you like me to call you? Dan. Okay, Dan. So, for today, I am going to be assessing your cardiovascular system. I need to assess your cardiovascular system because to look for any abnormalities and if there is, I need to record it and to take actions regarding that matter to avoid any further complications. Will that be alright for you po, Charlene? Okay. So, after that, you can start the assessment. So the first thing I'm gonna be doing is to auscultate the carotid artery for bruits. So in auscultating the carotid arteries for bruits, I need to use the bell part of the stethoscope, and then I will place it in three different areas: nagal of the jaw, in the mid-cervical area, and the base of the neck. So, and then I'll need to put a light pressure on it and let my patient take a deep breath every time I place the bell of the diagram on the different areas. Okay, can you take a deep breath? Now take a deep breath then. Take a deep breath. After that, you do it on the other side with the same procedure. Deep breath, please. And then deep breath again. Lastly, deep breath, please. Okay, after the assessment, I can conclude that there are no any bruit sounds or whizzing sound from the carotid arteries. This indicates that it is normal, and I can now proceed to inspecting and palpating the carotid arteries. Now I am going to palpate my patient's carotid arteries. So in doing this, I need to use my index finger and my middle finger. Also, we want to palpate the lower half of the neck of the patient to avoid the carotid sinuses, which is very sensitive. And then we need to put in mind to palpate one carotid artery at a time. So, okay, let's start. And then the other side. After that, I'll be grading it according to what I assessed. So everything is normal. I'll be grading it 2+, which indicates everything is normal, and then we can move on to the next part of the assessment. Now I am going to observe and inspect for my patient's neck, specifically the jugular vein distension, and then for the pulsation. While doing this, I need my patient to look at the other side for me to clearly see this part where the jugular vein is located. by doing this, I might need some light that will be very helpful for observing and inspecting, because that part of the assessment will be hard to see. That's why you need to have some lights. So let's start. Charlton, can you please look this way for me to clearly see this part? Okay, thank you. Okay, this muscle here across the jugular vein should be flat and not bulging and enlarged, as this might indicate abnormalities. So as I can see, all is flat and nice. The jugular vein is okay, pulsation is okay. Everything is normal, and that indicates that the patient is well. Now, I'll be moving forward to inspecting the precardium of my patient. And then what we're trying to look here is for the contour, pulsation, and the heaves. And then I'll also need to observe the impulse of the apical impulse located at the 4th to 5th intercostal space. So, as I inspect and observe, it is not pulsating. Now, let's proceed to palpating the precardium for pulsation. With doing this, I need to use the palmar surface of my hand with my 4 fingers, and then with the finger pads. We need to do it in a systematic manner. What we're trying to look here is the normal or abnormal palpation. From here, and then here, the 3rd, 4th, and 5th intercostal space. Then I need to palpate for the apical impulse in the atrial area, which is located in here. As I palpate, everything is in normal. After that, let's move on to auscultation. Using my stethoscope and the diaphragm and the bell area used in auscultation. So, while doing the auscultation, we need to do it systematically. So, first, I need to beginning at the aortic area, which is here, moving to the pulmonic area, then to the Erb's point, and then to the tricuspid area, and finally to the mitral area. Again, using the bell side in the same area stated earlier. What we are trying to focus here is the overall rate and the rhythm of the heart, and if it is normal. So as I auscultate, what I heard was normal, and then which indicates that everything is fine, and then the assessment is all finished. After doing the assessment, after doing all of the assessment, I can now move forward to changing my patient's clothes to its original clothes. I mean the patient's gown, and then I need to assess him into a comfortable position. So now, Charlton, are you okay? I'll assess you to a comfortable position. Is this okay? Okay, thank you. After that, I need to do a proper hand hygiene and then document the findings. And if there is any abnormalities, I need to tell it directly to the physician, and then we can recommend it to the person in charge with the different abnormalities. So that would be all. Thank you.